Have you ever looked in the mirror and thought, if only I could tuck this in here, or maybe plump this up a bit there? Then you scroll through social media, and suddenly you're bombarded with offers for a quick fix. Do this, nip that, and you'll be an instant star. But hold on a minute. Are you aware that many popular procedures, those sold to us as light touch-ups or easy tweaks, are actually shunned by genuine medical professionals? I mean it. There is a list of interventions that no honest surgeon would ever recommend purely for beauty, without solid, undeniable medical grounds. Today, we aren't just going to list them. We're going to expose the truth, the information usually buried in the small print of the contract. You're going to learn about 20 procedures that have the potential to turn a perfectly healthy life into a never-ending cycle of treatment. Some of these items genuinely might shock you. Are you ready to discover what's really hidden behind the glamorous facade? Let's dive in. Before we begin our journey through the world of cosmetic surgery, let's clarify one critical thing. What exactly constitutes a medical indication? It's not just a note from the doctor. It's a situation where the risk of not having the operation outweighs the risk of the operation itself. For instance, if a deviated septum prevents you from breathing properly, that is a medical indication. But if you simply dislike the shape of your nasal tip, that is pure aesthetics, and that is the crucial distinction that modern marketing has completely blurred. We've been led to believe that cutting off a piece of your body is as simple as getting a manicure, but you cannot cheat biology. Any intervention is fundamentally trauma. And today, we are talking specifically about those instances where you risk your long-term health for the sake of a trend that will fade in 5 years, while the scars and consequences stay with you forever. Let's start with the classic procedure that everyone's been absolutely buzzing about. That's the removal of Buccal's fat pads. You know, those little fatty pockets right inside your cheeks. Everyone wants those sharp, defined cheekbones a la Angelina Jolie, don't they? And surgeons are only too happy to carve that fat right out. But here's the rub, isn't it? Picture a balloon that's gone completely flat. Your skin is going to sag. Buccal's fat isn't just useless tissue. It's actually the underlying structure, the scaffolding of your face. Nature didn't put them there for decoration, you see. When you're young, your skin has elasticity, and everything looks quite chic. But fast forward 10 years, shall we? Try to picture the face of a much older woman whose cheeks have truly caved in. That, my dear, is what awaits those who opt for this procedure without a genuine medical necessity. Your whole face just seems to slide south prematurely. Essentially, you're paying good money to look older sooner. What a cruel twist of fate, eh? Proper surgeons only recommend this if the fat pads are genuinely enormous and interfering with your bite, not simply because you want a perfect angle for a selfie. Right, let's turn our attention now to the fox eye look. We're talking about canthoplasty. This was a massive trend that really dominated social media just a couple of years back. The basic idea is that the outer corner of the eye is pulled sharply upwards towards the temple, aiming to achieve that dramatic, almost predatory slant. I grant you, it certainly looks striking in photographs. But here's where we need to take a step back and consider the basic anatomy. The human eye is an incredibly complex, delicate system. If you stop pulling and tightening skin in an area that fundamentally needs to remain supple and mobile, you are actively disrupting the eye's natural protective mechanisms. Think of it this way. Imagine you've pitched a tent and stretched the fabric far too tightly. Eventually, the tension just causes the material to tear. The principle here is exactly the same. All too often, the immediate consequence is that the eye simply cannot close properly anymore. This results in chronic dry eye syndrome, recurrent bouts of conjunctivitis, and persistent, irritating watering of the eyes. You might have aimed for an air of mystery, but what you'll actually end up looking like is perpetually tearful, usually while fumbling for eye drops. Unless there is a genuine reconstructive necessity, interfering with the natural shape of your eye opening is frankly playing with fire. Moving on, let's talk about rhinoplasty, or a nose job, but I don't mean just any old procedure. I mean the kind done purely to make the nose tiny. You know the look, those almost doll-like noses that seem to practically vanish from the face? The trouble is, our noses are primarily there for breathing, not just for aesthetics. When a surgeon trying to cater to current trends narrows the nasal passages too aggressively, they are literally cutting off your oxygen supply. Imagine having to breathe through a cocktail straw for the rest of your life. Try pinching your nose halfway right now and breathing like that for a couple of minutes. Unpleasant, isn't it? Now imagine that feeling is permanent. Functional rhinoplasty, the kind that fixes a deviated septum after an injury, is a true blessing. However, reducing a nose down to the size of a button often causes the nasal valve to collapse with every single breath. Does beauty truly demand sacrifice? Perhaps, but certainly not at the cost of oxygen for your brain. Moving on to number 4 on our list, blepharoplasty or eyelid surgery, performed prematurely. Nowadays, it's become quite fashionable to have this procedure done almost as young as 25, all in the name of opening up the eyes or brightening the gaze. But let's remember some basic physics, shall we? If too much skin is removed from the upper lid, the eye simply won't close properly anymore. This condition is called lagophthalmos. I know it sounds rather like a spell out of Harry Potter, but trust me, in reality, it is a genuine nightmare. You end up sleeping with your eyes semi-open. The cornea dries out, it becomes cloudy, and before you know it, you're facing serious sight problems. The skin on the eyelids is incredibly thin and delicate. One slip of the scalpel, 1 extra millimetre of removal, and you're left with a perpetual look of surprise. And, crucially, constant discomfort. Doctors truly recommend this only for genuine sagging that actually impedes your vision, what we call ptosis, and certainly not just because you're bored. Right then, let's turn our attention to the body, specifically liposuction. Now, lots of people mistakenly think it's a quick way to shed the pounds. That is the biggest fallacy going. Liposuction is purely about contouring and sculpting. It's not a fix for serious obesity. If you're weighing in at, say, 15 or 16 stone and you opt for liposuction, you're making a grave mistake. Imagine trying to bail water out of a sinking boat with a teaspoon, but you haven't actually fixed the leak. The fat will simply come back. And here's the genuinely frightening bit. It might not come back where it was before. It can migrate to the visceral area, meaning it wraps itself around your internal organs. That is a direct route to diabetes and serious heart issues. Without a proper lifestyle change and consulting an endocrinologist, liposuction is just money down the drain and a huge amount of unnecessary stress on your body. Doctors prescribe it specifically for dealing with those stubborn fat pockets that no amount of diet or exercise seems to shift, not as a substitute for getting proper nutrition. Procedure number 6 is the removal of ribs, all for the sake of achieving a slimmer waist. It sounds like something straight out of the Middle Ages, some kind of horrific torture. Yet people are still doing this today. Our lower ribs aren't just for show. They are crucial armour, protecting vital organs such as your kidneys, spleen and liver. To remove them is to deliberately strip your body of its natural internal shield. Imagine taking the bumper off your car just to make it look a bit sportier, and then you get involved in a minor traffic accident. Any sharp blow to the side, or even just a simple slip and fall on the ice, could result in a ruptured internal organ and land you straight into emergency surgery. What's more, without the structural support of the ribs, your spine begins to bear an enormous, unsupported strain. This immediately leads to severe posture problems and chronic back pain. Yes, your waist might be smaller, but is a tiny figure truly worth living in perpetual fear of the slightest bump or jolt? Trauma surgeons, quite frankly, are horrified by this particular approach to aesthetics. Let's now address what is perhaps the most dangerous cosmetic procedure of recent years, the BBL, or Brazilian butt lift. The concept involves harvesting fat from the abdomen or other areas and injecting it into the posterior. It sounds like an ideal body swap, doesn't it? However, the mortality rate associated with this surgery is quite frankly one of the highest in all of aesthetic medicine. The issue is structural. The buttocks contain a dense network of large veins. If a surgeon happens to inject the fat too deeply, even by accident, it can breach a vessel and enter the bloodstream immediately. This complication is known as a fat embolism. A droplet of fat travels directly to the heart or lungs, where it can cause a fatal blockage. This outcome is instant. It truly is a game of Russian roulette. In fact, many highly experienced plastic surgeons refuse to perform the procedure due to the risks involved. Unless there is a legitimate medical necessity, say reconstruction following a traumatic injury, to deliberately risk your life simply for a better bikini photograph is nothing short of reckless folly. We urge you to keep this in mind the next time you encounter an advertisement promising the perfect silhouette. Number 8 on our list, calf implants. Yes, that's right, implants in the calves. Men often feel terribly self-conscious about having skinny legs too, and they get silicone inserted just to make the lower leg look muscular and defined. But the legs, particularly the calves, are areas of high activity, constant stress, and heavy blood flow. An implant can very easily shift position, pinch a major nerve, or lead to chronic lasting edema. Imagine having a foreign body constantly pressing on your muscles with every single step you take. This often results in what they call compartment syndrome. That's when the muscle swells and is essentially suffocated inside its own natural casing. It causes absolutely excruciating pain. Now here's the kicker. Building up your calves naturally in the gym takes time. Yes, but it's completely safe. The surgery gives you a quick fix, but the risk is that it might leave you permanently hobbling or even crippled. Unless there is a genuine medical need, say severe muscle atrophy following polio, this whole thing is frankly a remarkably foolish idea. And what on earth about changing the colour of your eyes? We're talking about keratopigmentation, or getting iris implants, you see. People want blue eyes instead of brown, and they'll stop at nothing to get them. They either use a laser to burn away the pigment, or they insert a coloured lens right inside the eyeball. It sounds like something out of a science fiction movie, doesn't it? But the consequences are dreadfully real. We're talking about glaucoma, cataracts, and in the worst case scenario, blindness. Your eye pressure shoots up because the eye's natural drainage system gets completely clogged up with all that released pigment. Just imagine painting over the windows in your house, only to have the paint start corroding the glass itself. Reputable eye doctors, ophthalmologists, only perform these kinds of operations to mask serious defects, like a corneal scar, for example. Doing this to a perfectly healthy eye, well, that's just a crime against your own eyesight, isn't it? Coloured contact lenses cost a mere pittance, and they are perfectly safe. Why on earth would you risk your sight for something so unnecessary? Our 10th item focuses on leg lengthening surgery. This uses the infamous Ilizarov apparatus. They deliberately break your bones, insert pins, and then you spend months tightening bolts to slowly, painfully stretch the bone growth. The pain is absolutely agonizing. It's sheer agony. You're looking at months, sometimes even years, confined to a wheelchair or stuck on crutches. The risk of severe, deep infection around those metal pins is huge. The bones might simply refuse to fuse, or they might heal crookedly, leaving you worse off than before. As the muscles and nerves are stretched, you also run a serious risk of losing feeling, or even developing complete foot paralysis. Now, this technique was originally designed for people with serious medical issues, such as limb length discrepancies or dwarfism. This is major, reconstructive, orthopedic surgery. And you want to go through all that just to be an extra couple of inches taller? Trust me, it absolutely isn't worth the trouble. You are trading years of an active, healthy life for a hospital bed and a terribly painful recovery. Honestly, just look up a few videos of patients going through the rehabilitation process. That little bit of vanity will vanish right there and then. Let's talk about the lips, and specifically about the procedure known as the bullhorn lip lift. This is a surgical procedure where a strip of skin is excised directly beneath the base of the nose, designed to evert the upper lip, making it appear fuller and plumper. And crucially, it's permanent. The issue is that the resulting scar, situated right under the nostrils, is always visible. While you can certainly attempt to camouflage it with makeup or foundation, the scar tissue remains. Furthermore, if the skin is tensioned too tightly, the mouth may struggle to close completely, leading to dry teeth and the development of what's often described as a strained or unnatural gummy smile. Constantly exposed teeth are naturally far more susceptible to drying out and subsequent decay over time. Once that skin is removed, there is absolutely no going back. It truly is a one-way ticket, unless you are dealing with a congenital deformity or the result of a serious injury. It is strongly advised that you stick to temporary fillers, which crucially, the body will eventually absorb. To surgically alter your face permanently for the sake of a fleeting fashion trend that will change in 5 years is quite frankly a disastrous long-term strategy. The 12th procedure on the list is cheek dimples, or dimple creation surgery. Lots of young women think this is awfully cute. The surgeon makes an incision inside the cheek and essentially stitches the muscle directly to the skin. Sounds simple enough, doesn't it? But often, this leads to quite nasty, thick scarring inside the mouth. The dimples might end up looking completely uneven, or worse still, they won't just appear when you smile, they'll be there all the time. Your face can end up looking permanently dented or pinched. On top of that, you are damaging your facial muscles. As time goes on, that artificial stitched area can loosen, causing the tissue there to sag and drop. You are essentially creating damage to healthy tissue. If nature didn't give you dimples, perhaps your face type simply doesn't need them. Mucking about with your muscle structure just for the sake of looking cute is frankly a very questionable investment. The next topic we need to address is biopolymer removal. This is fundamentally corrective surgery aimed at fixing a past mistake, but it serves as a stark reminder of why you should never put permanent, non-resorbable materials into your body. Back in the 90s and early 2000s, it was sadly fashionable to have these non-dissolving gels injected into the lips. Today, they are absolutely plaguing cosmetic surgery. The gel migrates, it gets severely inflamed, and it leaves the lips lumpy and often disfigured. We have to remove it, and unfortunately, we often have to take the surrounding lip tissue with it. Make no mistake, this is complex and often quite bloody surgery. The reason I'm bringing this up is to issue this very important warning. Never, ever use permanent fillers. A reputable medical professional will never suggest a forever product. If anyone promises you permanent results, walk away immediately. Run. The only thing that lasts forever are the complications and the resulting scar tissue, or fibrosis. You must stick exclusively to biodegradable materials, the kind your body can naturally process and safely eliminate. Coming in at number 14 is breast augmentation, where the implants are simply too large, completely ignoring the patient's natural proportions. It's a classic case of going overboard, what we call gigantomania. This is when a patient who is naturally a size 1 demands a triple D, and shockingly, the surgeon agrees. The skin simply can't cope with the strain, and remember, gravity is utterly unforgiving. The breasts rapidly begin to sag, leading to terrible stretch marks, and the sheer weight causes serious back pain. In some cases, the spine can even start to curve. What often happens next is that the body aggressively rejects the massive foreign object, forming a dense capsule around the implant. This condition, known as capsular contracture, leaves the breast feeling rock hard. Implants must be chosen based on the patient's actual anatomy, not some fantasy image pulled from a glossy magazine. A responsible surgeon will always refuse to use excessively large implants. They know that within a year, the patient will inevitably return, complaining of severe pain and major deformation. Let's shift our focus now to preventative operations. For instance, removing the appendix, just in case. Some people might think, why wait for peritonitis to strike? Let's just take it out immediately. However, the appendix is no longer considered a simple vestigial organ, as doctors once believed. In fact, it serves as a crucial reservoir or safe house for beneficial gut bacteria, making it an important part of our immune system. Studies show that individuals who have their appendix removed unnecessarily, that is, without acute inflammation, tend to take much longer to recover from infections and often experience subsequent digestive issues. Furthermore, any invasive abdominal surgery carries a risk of adhesions. These adhesions can stick the intestines together, potentially leading to serious complications like a bowel obstruction. Frankly, no competent surgeon in their right mind would recommend opening up the abdomen without clear evidence of acute inflammation. If someone suggests this procedure purely for prevention, you should regard it as outright quackery. Point number 16. Elective caesarean section. A C-section performed without medical indication. I don't want to give birth naturally. I'm scared of the pain. Just operate on me. Doctors hear this request very often. However, a caesarean is major abdominal surgery. It requires a significant incision into the uterus itself. This carries serious risks, the danger of hemorrhage, the risk of infection, and substantially increased risks for any subsequent pregnancies. That uterine scar is permanent. Recovery after a natural birth typically takes a matter of days. Recovery after a C-section can take months. The baby also misses out on the essential hormonal cocktail produced during active labour, and crucially, they do not pass through the birth canal, which is where they receive their vital first microflora. Caesareans are life-saving procedures when complications arise and when something goes wrong. But opting for one purely by choice, treating it like a routine appointment or simply a haircut, is an enormous health risk for both mother and child. Trend number 17, the so-called Jolie profile, where they use dermal fillers to sharpen the jawline. Now, while it's not technically surgery, it is an invasive and potentially quite risky procedure. People chasing that sharply defined oval jaw often have huge amounts of dense gel pumped into their lower face. It gives the face a very hard, almost boxy look. The real trouble is that this gel attracts water. So you wake up every morning with a heavily swollen, puffy face, what some people call a pillow face. Over time, the filler starts to migrate downwards, and instead of that crisp jawline, you end up with prominent jowls. The entire lower face appears heavy and rather saggy. Doctors have a rather blunt term for this look. I apologise for the terminology, but this is their medical slang. They call it the rich alcoholic's face. Frankly, this level of overcorrection just looks completely unnatural and harsh. You'd be much better off focusing on your posture and correcting your bite than pumping gel into your face. The 18th item is breast lipofilling. Using your own fat as a complete replacement for traditional implants. It certainly sounds appealing, very natural. The problem is, fat tissue naturally gets reabsorbed by the body and often quite unevenly. This process can lead to the formation of fat cysts, also known as oil cysts, and calcifications within the breast tissue. Here's the critical issue. On a mammogram, these hardened areas look exactly like early-stage breast cancer. You are setting yourself up for a nightmare of constant biopsies and cancer scares, because no radiologist can instantly differentiate between benign fat necrosis and a malignant tumour. If you just need minor shape correction, that's one thing. But attempting to increase your chest size by 2 cup sizes using fat alone is essentially creating future diagnostic chaos for your health screenings. Number 19. Navel plastic surgery, or umbilicoplasty. Women often desire the ideal vertical belly button. This procedure is frequently performed alongside a full tummy tuck, or abdominoplasty. However, the navel itself is essentially scar tissue, an area with relatively poor blood supply. Consequently, the risk of necrosis, that is tissue death, is extremely high here. The belly button can simply blacken and detach, leaving behind a severe open hole. Alternatively, it might heal into a crooked, raised keloid scar. This is such a minor detail that most people pay absolutely no attention to it in daily life, yet people are willing to go under the knife for it. Unless you are specifically addressing a hernia, our advice is clear. Leave your navel alone. The risk of acquiring an unsightly scar right in the middle of your stomach is simply too great for such a dubious aesthetic goal. And finally on our list, we have the rather shocking trend of tongue splitting, or forking, as some people call it. Now this is a serious body modification. Although, mind you, some people try to have it done professionally by a surgeon. Your tongue is essentially two muscles, absolutely packed with vital arteries and nerves. If you cut it open, you run the very real risk of a serious hemorrhage, bleeding you simply cannot control at home. And speaking of risks, your speech will be permanently affected. You'll likely end up with a severe, lifelong lisp. You'll lose sensation and taste sensitivity. Worse still, if a nerve is damaged, your tongue could be constantly numb or suffer from continuous chronic pain. This procedure is entirely irreversible. Trying to sew the tongue back together so it functions normally again is practically impossible. This is a profound experiment upon your own body, an experiment that could easily cost you the ability to speak clearly and eat properly for the rest of your life. Honestly, you must think about this 1,000 times over. Well, phew! That was quite the list, wasn't it? I haven't gone through all this just to frighten the horses, mind you. No, I simply wanted to remove those rather optimistic, rose-tinted spectacles. Surgery, let's be clear, is a magnificent achievement of mankind. It saves lives, it reconstructs faces after nasty accidents, and it allows people to breathe and walk again. But when medicine descends into just another business, fulfilling whims and fancies, that's when we run into serious trouble. Your body, my friends, isn't some sort of Lego model. You simply cannot swap out one piece for another without serious repercussions. Remember this mantra: the very best surgeon is the one who has the good sense to tell you no. If your doctor actively discourages you from having a procedure, treasure that advice. They are looking out for your long-term health, and that's worth its weight in gold. Thank you very much for watching right the way through. I sincerely hope that this chat will stop at least one of you from making a truly fatal mistake. If you found this information useful, do consider subscribing to the channel and hitting that notification bell. Now, just a quick question for you all. Which of these cosmetic procedures did you honestly think was completely safe before you watched this video? Do pop your answers in the comments below and let's have a proper discussion.